Hello, everyone. Welcome. Thank you all so much for joining us tonight. My name is Kevin Collins. I use he, him pronouns, and I serve as the Director of Training and Outreach here at Health Equity Solutions. And welcome to our second day of Health Equity Week. We're so excited for you all to be here. Just a little bit of background on Health Equity Week. The first full week of April is now recognized in statute as Health Equity Week. This week annually reaffirms Connecticut's commitment to eliminating inequities in health and ensuring all residents have the opportunity to achieve optimal health. This year, the focus of Health Equity Week is on the impact of Connecticut's lay health workers. A lay health worker is anyone providing non-clinical health services, such as a community health worker, doula, and/or peer support specialist. So welcome. We also wanted to get started tonight by thanking our sponsors. So thank you to our advocate sponsors, Universal Healthcare, Foundation of Connecticut, Connecticut Health Foundation, Equity Research and Innovation Center from the Yale School of Medicine, CARE, the Community Alliance for Research and Engagement, as well as Leading Culture Solutions. This week wouldn't be possible without you all, so we are so appreciative of our advocate sponsors.
Nice work.
Just for you all, so you all know you're in the right space. This is the right room, the right Zoom. This is a community conversation and panel on navigating Husky financial assistance, access, and affordability, brought to you by the Health Equity for the People by the People Coalition. We worked really hard to put together a program that's engaging as well as informative for you all tonight. So sit tight and participate as you can and as you may, and we will get started. Just one housekeeping or a couple of housekeeping notes. We would like for you all to please mute yourselves if you're not speaking, just to avoid any background noise. Closed captions are available when you click the CC box on your Zoom platform. Direct tech concerns or any private questions that you have to myself, Spanish interpretation is available tonight. So please click on the small world icon on the bottom of your screen. And if you're using your phone, please click on the three dots to access the interpretation room and choose your language. And I will pass it to our interpreter, Carlos, to translate that for us. Awesome. Thank you so much, Carlos. And with that, I will stop my screen share and pass it to Latoya.
Good evening, everyone. Thank you so much for being here. We are looking forward to a wonderful event this evening. Thank you for all of the housekeeping, Kevin. So my name is Latoya Tyson. I use she, her pronouns, and I am the Community Engagement Manager with Health Equity Solutions. I will be your moderator for this evening. But before we do that, I would like to turn over the event to Brigitte. She is going to give us an introduction to the Health Equity for the People by the People Coalition.
Thank you, Latoya. Hi, everyone. Good evening. I'd like to welcome you to our community conversation and our panel discussion. Today, we're going to be talking about Husky, financial assistance, and just general health access. As said before, my name is Brigitte Rivera. My pronouns are she, her, ella. I am a community organizer with Make the Road Connecticut. The intent of this event is to have a really structured and robust conversation with our moderator panels here to talk about, as said before, Husky and health advocates who really serve clients and patients who are uninsured, underinsured, or who have economic disadvantages. Together, we'll discuss and educate community members about current opportunities to access healthcare, methods to navigate Husky, and how to take advantage of policies that exist in regards to financial assistance and ways we can all take collective action to improve our healthcare system together. This event is being conducted by the Health Equity for the People by the People Coalition. Health Equity by the People for the People Coalition is in Connecticut, based of organizations that are really working to make healthcare more affordable by organizing Black, Brown, and immigrant communities to fight to increase access to affordable health insurance for local residents and all immigrants, regardless of their immigration status. The coalition is made up of Health Equity Solutions, the Ministerial Health Fellowship, Make the Road Connecticut, and Connecticut Students for a Dream. In the chat, I believe there will be a link where you can see more about our coalition and learn more. Again, I would like to start this conversation by welcoming you and to remind you all again to please, during this panel, mute yourself to reduce background noise that can occur and disruption and possible disruption. There will be opportunities for interaction, and we highly encourage all to participate. And you can do this by raising your hand virtually to be called on or taking yourself off of mute. We highly encourage to please wait to be called on, as there may be multiple people trying to speak and also raise their hand. But we will ensure everyone's voices is heard throughout this entire event. Otherwise, you can also put your questions and comments in the chat throughout the entire conversation. Your feedback on this conversation is really important to us. This is our first one of the year, which is really exciting, but we also want to continue growing and doing better and receiving more input from community members. Therefore, we highly encourage you and ask that you complete the end of the forum evaluation, which will be put in the chat at the end of the discussion. And now I would like to start by turning the discussion to a fellow colleague, Eric Cruz Lopez. He's going to talk about the Husky for Immigrants Coalition and give us a brief overview about the campaign.
Hey everybody, this is Eric I'm the organizing manager at Connecticut Students for a Dream. And I think I'm gonna get to the Husky for Immigrants Coalition later. I think what I'm gonna do right now is make sure that we're all on the same page around what Husky is, since the majority of this panel is going to be focused around Husky and issues, involving Husky and how to fix some of those issues. So what's Husky? Husky is the state's Medicaid program that provides health coverage for free or at a low cost for low-income individuals. And there are different Husky programs, but they, I believe, all fall under Medicaid. And I think that's going to be the simplest, explanation that I'm going to give about Husky. And I just wanted to share that to make sure that we're all on the same page around what we're talking about. So Husky, again, is the state's Medicaid program that provides health coverage for free or a low cost for low-income individuals. And we'll get to the Husky for Immigrants Coalition later. I believe we'll have more time to talk more in depth about the work that each of us does. But for now, I'm going to turn it over to Aisha Clark to give us a brief overview on financial assistance policies and their importance. So I'll pass it over to you.
Thank you so much, Eric, and thank each and every one of you for joining. My name is Aisha Clark, and I am the Interim Executive Director of Health Equity Solutions. I use she, her pronouns, and I am so excited to be here with each and every one of you.
No, Miguel, no me hagas así la pasión.
Am I talking too fast for a translator? I want to make sure that I'm not. Okay, no problem. Thank you so much. I appreciate it. And I'll make sure that I slow down because I tend to talk fast. So please raise your hand if I end up talking a little faster than the interpreter. So I just want to make sure I'm cognizant of that. As I shared, I use she, her pronouns, and I'm just excited to be here with the coalition to just share a little bit about what information as it relates to hospital financial assistance programs are available. And the work that we're looking to do as it relates to helping shift some of the things that are happening. So right now, hospital financial assistance, what that is we are hospitals, more or less nonprofit hospitals, they are required to have and offer a financial assistance program. Within that financial assistance program, you'll sometimes hear words called charity care. This is a way in order to find a space to have an application process for free and or discounted health services for people who meet the hospital's financial assistance criteria. Many times it's due to your income and or resources that you are receiving. What we would like to see more in the state of Connecticut to really help when we're talking about affordability of healthcare, ways to decrease medical debt, is to really have a more streamlined process where there's more accessible ability to utilize a financial assistance program. And so what that means is creating a universal application for financial assistance that's accepted throughout the state of Connecticut by all the hospitals. Currently, each hospital has their own protocol set up. And so what we're looking to do is create a space to have a universal application. Another part of that is being able to screen individuals who are uninsured and or underinsured, because as many of you all know, there are times where there are unexpected places when you are unfortunately going to the hospital and you might not have the ability to pay because you don't have enough insurance and or if you don't have insurance. So being able to be screened before your debt is being sent off to collections and something that's very important that we are looking for the hospitals to do. And this is really in a space for those who have difficulty paying medical bills, which would have been covered by health insurance, but they could not afford to pay them. Another aspect of financial assistance is making sure that people know about the financial assistance options. As we've learned throughout our listening sessions and community conversations, is really understanding that there are many individuals who do not know about the financial assistance program. And so it's important for them to know about this. This is making sure that we're requiring signs to be posted throughout the hospitals, looking to have information be put at discharge, an application process and or information about the process at the moment of discharge. And when a person receives a bill, that the option to join the financial assistance program is a part of that. So really helping individuals who might not know about there is a way to pay this bill that they receive for, let's just say $10,000, that there is some assistance that's out there that they potentially could qualify for. So we're hoping to make sure that we are getting that. The next part of some things that we're looking at is to offer reasonable payment plans to people who are ineligible for help. This means that there are some individuals, unfortunately, who might not make the income requirements. However, they are still unable to pay the medical bills. And so being able to provide a space to look at what are some options and payment plans that could be helpful for individuals before their debt is sold off. And when I use the word sold off, that means that the hospitals are then sending the bills to collection, which we know, unfortunately, disproportionates individuals who are in marginalized communities, where now this information is on their credit score, which stops them from getting housing, stops them from getting, sometimes it stops them from getting credit and all of the different things. And so we want to make sure that we're providing a space where we're not disenfranchising individuals because they don't have the ability to afford going to the hospital. And then the last part is really a space of looking at setting a standard eligibility limit for hospitals. And this is really a space where going into the hospitals and looking at, is there information for a screening process, where there is additional costs for hospitals that may not need to happen, and making sure that hospitals are looking at the services that they're providing. This is the ability to allow for more accessible financial assistance. We will learn more as we go through the panel about looking at accountability, making sure that hospitals are held to standards of ensuring that this information is done, that there's a transparency process, and we'll learn more about that. But I wanted to just give a high level overview of what financial assistance is and what we're looking to do within the state of Connecticut. And so I just want to thank you all for your time, and I will pass it over to LaToya.
Thank you. So first and foremost, I'd like to take a moment to thank both Eric and Aisha for giving us some overview of not only Husky and what Husky is, but also the financial assistance policies, giving us all kind of a foundation to work from. Not everyone is always familiar with these particular terms, and we wanted to make sure that everyone is aware of what we're discussing tonight. So I do want to start in on our panel discussion. And the first question I'd like to start with is a question that I am going to be directing specifically to the coalition members to start, especially since we're really talking about financial assistance and Husky in the context of legislation and how that affects everyone. So for the coalition members, if you'll take maybe 1 or 2 minutes to just please tell us what you are doing in your respective agencies in relation to the legislative session to promote healthcare affordability. And I will give that to Reverend Anderson to start, if you don't mind.
Sure. Good evening, everyone. It's certainly good to be here on today. I'm Robin Anderson from the Ministerial Health Fellowship. And so our, really agenda items around affordable health care is to, we're looking to raise the income level for Cover Connecticut to 300%, to be able to accommodate, especially those persons that, the minimum wage continues to go up. And so as the minimum wage continues to go up, really could endanger persons really qualifying for free insurance. And so therefore, or having a premium that if you make minimum wage, there's just no way you can really afford a premium. So you'll make a decision whether or not you eat or whether or not you pay your premium, which could leave you in a position in which you don't have any insurance for yourself as well as for your children. We are also continuing to testify, do testimonies. We're gathering stories, talking to our legislators, also around really making sure that reimbursement costs for community health workers, as well as doulas, are also part of the policy change and the policy making this year, that a bill would actually go forth that would continue to sustain community health workers and doulas in the actual community, and the important role that they are playing and the difference that they're making in their communities, especially even the doulas as it relates to infant mortality, maternal health needs. And so, and then we're also looking at the fact that, again, medical debt is so very important to us for all of the reasons that Aisha has also mentioned. Also, and you're going to hear some stories about some persons that have encountered medical debt through our doula that is with us on today, Brenda Rivera, just around some of the issues that persons have had, just so you know that those issues are really real. I've even experienced it myself, but it does hinder persons from accessing help or either going to the doctor or the hospital because they don't want to incur a debt. They don't want to incur co-payments, which also compromises their health. And as we continue to look at and address health disparities, especially policy changes that need to happen so that people of color can live and not have to compromise their health or healthcare needs. And then also oral health. One of the things that is always so alarming about oral health, which affects our whole entire health, and that is that people of color at the age of 45 years old, especially in the African American community, 45% of them at 45 do not have their original teeth because of poor or affordable oral health care. And so those are some of the agenda items that we have in advocating for Husky. Husky would be not just for pregnant women, but for all adults and for all people. Husky for immigrants. We're continuing to promote that also, and to raise the age of 12 to also 18 in adults, period. Thank you.
Awesome. Thank you very much, Reverend Anderson. Bridget?
Yeah, thank you, Latoya. I think apart from the Husky Coalition, which I'll let Eric talk about, something that we really pride ourselves in doing is our local campaign work for the city of Bridgeport and Hartford. This campaign really is led by people who come together and together they discuss the challenges that they face in health and accessing health, going to the hospitals or clinics, and we come up with solutions. And so what we've been doing this whole time is working with hospitals and clinics, Department of Health of Bridgeport and Hartford, to ensure that the challenges are being addressed and that there are solutions. The solutions that the community members are coming up with are being implemented in the health facilities. And so what does this look like? Go to pause for interpreter. It looks like having people be able to go to the hospital and get quality interpretation that they can give feedback to. It looks like people being aware that there's a financial program because people don't know that sometimes. It looks like being able to call the phone, and if you don't speak English or Spanish, still being able to get where you need to because there's 5 other languages that are available to you via phone. If these things aren't being met, if there's no cultural training for staff in health, if there's no accessibility to the programs that they're offering, or programs that they don't offer, right? Because there's clinics that don't have dentists, clinics that don't have therapists, but they should have the responsibility to still inform you as a patient and guide you to the health process to ensure that you do get the health care that you need, that you do get to see a doctor. Even if the facility doesn't offer it, you should still have the right to know where to go when you need to see and seek that health. And so right now we're working directly with community members to ensure that they're in part of the conversation with direct executive members of Hartford hospitals and also all hospitals in the city of Bridgeport and in the city of Hartford to ensure that the demands or suggestions that they have are being met. And their voices are being empowered because they're the ones who have to go to the hospitals. So they're the ones who have the solutions to the challenges that they're seeing.
Awesome. Thank you, Bridget. I just want to remind the panelists that we do have a couple of other questions as well. And so we want to keep things a bit brief as we're answering. But if you will, Eric, can you give us what you guys are doing?
Of course. And again, Eric Hiel from Connecticut Students for a Dream. And we're part of the Husky for Immigrants Coalition, which is a coalition that Connecticut Students for a Dream, and specifically, I want to honor young people helped start. And so what do? Right? We talked a little bit earlier about what Husky is, but something really important to know in most of the country, and specifically in Connecticut up until a few years ago, is that undocumented immigrants actually do not have access to Husky, any of the programs within Husky. And so over a few years, C4D, Connecticut Students for a Dream, and other organizations have had conversations about this access and understood that our communities, need a bunch of stuff, but also need to go to the doctor. And so a few years ago, this coalition took off and started pushing for immigrants to have access to the Husky program here in Connecticut, following in suit with other states who have opened their Medicaid program up to undocumented immigrants. The coalition is composed of a lot of different organizations. I'm not going to be able to name all of them, but Health Equity Solutions, Make the Road, Connecticut Students for a Dream, form some of the organizations in the coalitions that work on this campaign. Over the past 3 or 4 years, we've had a lot of wins, and we keep winning, and we hope to continue doing that. We've opened up Husky for children 0 to 12. We've opened up Husky for prenatal coverage and postpartum coverage. And hopefully this year we expand that coverage up to age 26. And that's what we want to keep pushing. And we want to make sure that the conversation doesn't end at kids, as it often does, but that it expands to everybody, because a healthy family is not just about the kids, but is also about the parents, the uncles, and really anybody else in our communities. So that's what we're working on. Right now, we're fighting for HB 6616, and I hope that y'all will continue to support us in doing that. Pass it back to you, LaToya.
Awesome. Thank you, Eric. And Aisha?
Oh, thank you, LaToya. So HES, and then just as long with many of you are here, we are working, and as I shared about the financial assistance program, we are working with that, and that is a bill that we would like for everyone to ensure that they are talking about and looking at. And that is the HB 6740, an act concerning hospital financial assistance policy. So that is one of the bills that we are working on. And then another one is for, and many of you shared it. Excuse me, sorry, Bridget, you talked about it. It was really about making sure that there's connection between, or a liaison between hospitals to the patient, to what services are available. So really pushing for a community health worker reimbursement program where community health workers are being reimbursed through Medicaid reimbursement. And that is Senate Bill 10. And so we are really excited about that work, because that was over 100 community health workers that are really came together to come up with what this could look like, ensuring that there is person-centered, that it's the person is actually being centered, and being able to look at them and not just getting people in and out, but really looking at what the needs of the patient is. And then making sure that community health workers have a livable wage. So really helping increase the workforce and economic stability. And then being able to really help with inequities that we know that our complex health systems are available, and being able to be that liaison, as many of us have shared, where you need that person there to help support that. And so I don't want to take up too much time, but just those are two of the big ones. And then following the racial, ethnicity, and language data collection, and then the racial impact statements, and looking at that to ensure that they are being used. So those are just a few things that HES is working on.
Awesome. Thank you so much, Aisha. Hopefully, folks in the space will be able to, if you have more curiosity about what each of the agencies here are working on in the legislative session, There will be links to each of our organizational websites in the chat so that you can look us up and get more involved for those that choose to. So under that vein, since we're kind of talking about community health workers and doulas and, you know, all of the pieces surrounding them, I do want to direct this next question initially first to Brenda Rivera and Reverend Anderson. So Brenda, if you would, can you talk to us a little bit about what some of the benefits of doula services are? And if Reverend Anderson can come behind you and then talk about how coverage expansion under Medicaid would be beneficial to doulas.
Okay. Good evening, everyone. I'm Brenda Rivera, doula for Pregnant with Possibilities, and under the umbrella of Ministerial Health Fellowship and leadership of Reverend Anderson. So, and thank you for having me. I would like to just talk about a few of two of my ladies, just to mention a couple, just and their experience, and then I would more further explain. I have it written right here because if not, I would just go all over the place. Okay, so a client that lives in Clinton, for example, she had insurance bills very high when she came into our program. She was 4 months pregnant and she didn't have Husky at the time, so her prenatal bills were racking up. We were able to help her navigate through the system, apply for Husky insurance, which she was approved for. However, there was no retroactive pay that would go back to the prenatal visits. And we worked to help her, and since Middlesex does have the bed funds, we were able to help her get, you know, the bed funds approved to cover her medical bills. But then we have another pregnant mom who came in at 2 months, and she had no insurance, and we were able to help her. She came in early on, so we were able to get her Husky approved for her prenatal bills and everything. However, her old visits were not at Middlesex, so now where would she go to get those bills paid, the visits? And so we had issues with her. She still has bills that she hasn't been able to get covered, and she's a single mom. She has a 6-month-old baby and an 8-year-old son. It's stressful for a mom, a single mom especially, to have no insurance or have bills under them. An immigrant coming from another country and just not having any family out here and just being completely alone. So that's just a few of my ladies that I've had, but the benefit, I mean, us being able to help them navigate, a lot of them don't know English, and you can say they have the translating iPads at the hospital, but that's just not enough. They need someone that's there with them personally, that looks like them and is able to help them and support them through the process of that they need. Translation is, you know, when it comes down to doulas, it's much more personal, you know, than just translating. We can go to their homes, we can connect them to Birth to 3 and be there when they come in and introduce them and just be there for that support. So that's just a little bit of what we do.
Awesome. Thank you
I think
so
I
much,
would just
Brenda.
add to that also that you know, also part of the doula services also is to help persons that have questions that want to ask their doctors. Many times you know, there's some intimidation because sometimes the doctors don't look like them, and you know, some of the women have expressed the fact that they leave there feeling like they're not being heard, or there's questions that they have, but they're feeling intimidated. So a part of the doula, you know, doulas are able to do is to really sit down with them, talk to them about, well, what would you like to ask? What are some of the questions that you want to ask your doctor? What are some of the things that you're concerned about? And then to be with them during that visit, to coach them in that process, and to be with them during that visit, to be able to ask, you know, their doctors questions and, you know, tell them, you know, about the concerns that they have, and to have a better understanding, but also to feel like they're in, you know, they're in the driver's seat. They're pregnant with this child that has possibilities. They have possibilities, and they do have a voice, and they do have a right to ask questions, to, you know, gain more knowledge and understanding about the birth of the child that they're actually getting ready to deliver. And then to be there during the delivery process, to, you know, see that they have a team of people, but mainly someone that's also there, that's been there to support them throughout their pregnancy as they go through this labor, you know, process. Many of our women, because they're at risk, have had stillbirth. Some of them have had, miscarriages, or just have had, if they describe it, awful childbirth, and really felt like everybody was talking to everybody, but nobody was really talking to them and there for them. So they're there to also provide that emotional support. And then even during their postpartum period, the doulas are working very closely with them so that those women that may be having some concerns, like even the other day, we had a woman that was really still having trouble. She was still hemorrhaging. And so, just really coaching, you got to go to the doctor and talk to the doctor. Well, she did get to the doctor, and sure enough, some of her placenta was left inside of her. And so she had gotten an infection. And so right away, the doctors began to really work on her during that period. So we've seen movies, and especially the one Aftershock that has come out, but we know many stories, horrible stories about women that have hemorrhaged and have died, right after childbirth or within the first year of their childbirth. So these are some of the things to me that are important services that doulas, provide. And so I think it's, important that we sustain those services and that we make sure that they're going to be around forever. They are important. And that also, if we're going to address health disparities, if we're going to address racist, systemic, and structural racism, and also if you're going to help people to live longer than they do, especially women, then we have to be able to have those services, to me, in place, those important services that continue to promote good health care for the woman as well as the child that they're actually carrying. And the same thing with, to me, community health workers. It's really helping people to navigate these systems and to have someone, that's there with them, that's bringing them through that process, telling them what they have access to, and helping them, access a complicated system, and also a system that is not always so welcoming to people of color.
Mm-hmm. Yes, very powerful. It sounds like the doula services in particular, when it comes to pregnancy and really working with those individual clients, it sounds like has been extremely beneficial to them. When we're talking about coverage expansion, Reverend, how would that expansion under Medicaid be beneficial specifically for the services that the doulas and the community health workers provide?
It will sustain the services for a long time to come, because the funding would continue to be there to continue to pay for those services through their actual insurance also.
Awesome. Something for us to all think about. Thank you, ladies, very much. So under that vein, that kind of bridges us into talking about cost and the impact of the cost of healthcare. So this question, I'm sorry?
No, I was going to say it would also, in the long run, reduce the cost, also of healthcare.
Right. Okay. Well, that's the question that I'm going to ask, and this question is for the entire panel. So the question is actually a two-part question. Firstly, how does cost impact the quality of healthcare access for the populations of folks that we serve? And in conjunction to that, what could be the impact of more affordable healthcare on these populations? Does anyone in particular want to start?
LaToya, I don't mind jumping in, and then I'm sure the great panelists will chime in. So one of
Absolutely.
the main things that we know, that there's a space within our health systems, not just in Connecticut, but throughout the nation. Systemic racism has really plagued our health systems, and it's really trails out to the affordability of it. So not having adequate wages, education, and employment then results in the inability to have the best health insurance, and or having to be placed on high deductible plans, which will result in high out-of-pocket costs, then trickles down to individuals not being able to pay, which disproportionately affects Black and Brown. And so to answer your question, like how would it impact if we can, if it was an easy path to just say, if we can make insurance affordable while we're tackling the space of creating better jobs and decreasing the wage gaps, decreasing the wealth gaps. If we can do all of that, then it will lead to better outcomes in job placements, better insurance and all of that. But one of the first steps is really addressing and acknowledging that we have insurance plans that are in place that are high deductible and they disproportionately affect Black and Brown. So if we can really have that to be more affordable, and also access to immigrants, then we will see a decrease in one of the biggest things we've been talking about is the medical debt. So just wanted to throw that out there, and I'm sure my esteemed panelists will say some things as well.
I wanted to maybe answer part of the question around like the populations that we serve. As an organizer, I think it's important for me to share that we don't serve, we organize, right? And so we work alongside the community that's affected to change the policies, some that Aisha mentioned, some that other folks on this panel mentioned. And so that's the work that we do. And then specifically for myself, I'm undocumented. I've had health insurance for a total of 1 year in my whole life. Right. And so I understand kind of what it feels to have unaffordable healthcare, but also to not have healthcare at all. And knowing that the cost of not having healthcare is also very high. Right. Because in that 1 year that I had health insurance, I went to a lot of doctors and it was still really expensive. Right. And now I'm going on, I think, like year 7 of still not having health insurance. And so I'm not looking forward to what that bill is going to look like when I do eventually get health insurance and get to go back to the doctor and, see what has piled up over 7 years. And I think something really important for us to think about, right, in terms of Husky, but also private health insurance, is that by expanding Husky, by expanding the state's Medicaid programs, we actually help people better negotiate their salaries and their job places when a negotiating tactic isn't the health insurance that their employer provides, right? And so by expanding Husky, by expanding the Medicaid program of Connecticut, we actually allow workers to have a stronger voice in their workplace to negotiate their salaries and their working conditions. Thank you.
Powerful. That just reminds me that sometimes I think people forget how powerful they are, especially when they're in certain positions and they just don't have the knowledge or the education around specific issues like insurance and being able to negotiate wages and things like that. I think that's a good reminder for us, Eric. Thank you. That we are all very powerful in our own right. And we each have the capacity and the ability to create some better for ourselves in small ways. So that is awesome.
I think I would say that also, to me, it's so important that everyone deserves to have health care and have affordable health care. And as we look at just, again, over the years, over 400 years, and we've seen over and over again the amount of people of color that live less longer than less longer, Lord. They live
their lifespans are shorter.
People of color that actually die, at an earlier age than their counterparts who live longer than they do because of their inability to have access to health care and also to have affordable health care. To me, that's just an indictment to the nation, and also continues to support structural and systemic racism. And so, and it also makes persons also leery about the healthcare system, and really that the healthcare system is not really for them or making it available to them. and therefore not even really trusting the healthcare system to have their best interest, also. And, I think that, just making a decision, and also even to, the access that they do have to the healthcare system, not really knowing what access they do have and what is it that the healthcare system is able to really provide for them, and to be concerned about whether or not they get a raise that may be still putting them at the minimum wage, in terms of what actually the minimum wage has been raised to for this year, and still living in poverty and all of those kinds of things, along with the fact of not being able to have affordable health care and to have access to the healthcare system, inability to be able to navigate the healthcare system when they do have health insurance, or to know even how to sign up for it, or to even go through that process. To me, again, it's something that everybody ought to be concerned about. And so I know, even as the faith community, that churches are also not just churches, entity to themselves, but also we're part of a community of persons that live in that community that may not ever come to our churches, but we provide services for them. So part of the work that we do also even has ministers, and also from the faith community, as well as community leaders and organizations that have come together also, and we go door to door, knocking on people's door, giving them the information, making sure that they're educated, and also really asking them to come and join the work and to lift their voices of what needs to happen. And I think even like Aisha even mentioned, those community health workers, over 100 community health workers, who are also very much a part of the bill that's also promoting community, the reimbursement, for community health workers. So that's them also lifting their voices. So a great part of this is to continue to let the community know that they do have power, and that the only people, I always say, can save us is us, and not without us, but with us.
Hey, ooh, that was some powerful stuff right there, Reverend. And you know what? It's a statement that we, again, need to be reminded of, because we don't always remember, especially when we are people who speak a different language, or we believe that we have a lack of certain education, so forth and so on. We don't always remember that we actually hold power, and we have power that we can exert. And so I appreciate you bringing that up.
Because a lot of us pay taxes, and even some of us that don't pay tax, we pay enough taxes for those that may not be able to afford to pay taxes because they cannot find jobs. And so therefore we ought to have the amenities of everyone else.
Absolutely. Absolutely. Thank you very much to all of the panelists. We have just a few minutes, and I did want to give an opportunity at this time for us to also involve our community members who are in the space. We have had a lot of information given to us within this time frame, and there may be some people that have some questions and or would like to share a story of their own about some of the difficulties that they have had with accessing healthcare, and like what that was like for them. So is there anyone, would anyone like to ask a question of the panelists and or share a story of theirs? Please feel free to raise your hand and or take yourself off of mute.
Yes, my name is Monica Dawkins, and I'm with the Ministerial Health Fellowship and one of the case managers on the team. And certainly this is an issue of great importance, because in working with a lot of our participants, as has already been stated, I had one person who had to go to the emergency room because she was having some issues with her heart. And she did have insurance, but she did not have adequate insurance coverage. So this is really, really key because sometimes people don't know until they find themselves in a medical, dire situation where they, she couldn't go to a walk-in clinic and she ended up being referred to an ER, and then several months later had a medical bill in excess of over $4,400. And certainly not having had that kind of money to be able to pay it right away and having to work on a plan, she was very nervous because she is not documented, and she also was afraid in terms of going forward what that was going to do to her credit. So we have been, working with her to support her around, getting connected to the Department of Social Services as well. And so it was interesting for me to hear the other gentleman talk about having been undocumented and some of the issues that he had to face. So that's, one of my stories that I would like to share as well. This is really something that we really have to work on to try to help others. So thank you for allowing me to share.
Absolutely. Thank you so much, Monica. We appreciate that. I do see some hands raised, so I would like to call on folks. I see first Carla, and then Lori, and then Minerva. Carla?
Sí, buenas noches. Mi nombre es Carla Esquivel. Soy la fundadora de una organización, Nosotras, en Stanford. Gracias por toda la información que nos han dado esta noche. Quisiera preguntarles, en lo personal, yo tuve que ir al hospital hace 4 años atrás. La deuda era, creo que de $1,000. Ahora me están llamando y me están cobrando $2,500 y siempre estoy recibiendo llamadas. Alguien me ha dicho que no tengo por qué pagar ni tengo por qué responder porque el de hospital vendió la deuda. ¿Qué tan cierto eso? ¿Cómo podemos hacer como comunidad inmigrante que no tenemos documentos, que no tenemos un seguro social para actuar o para poder ver qué podemos hacer con eso? Eso me ha dañado mi crédito. Y cuando las personas me llaman, siempre yo le pregunto, yo le he dicho, sabe, usted no me puede estar llamando, esa cuenta, el hospital se la vendió a usted arréglese con el hospital. Y me han dicho, usted sabe que esto lo estamos grabando, que esto puede usarse en su contra. ¿Qué hacemos ante esos abusos?
Oh, that's an interesting question for the panelists. Does any panelist member have a response for Carla?
I just wanted to just get clarity because what I heard was that she was told that they can't call, but if the debt is sold from the hospital to a collections agency, the agency can call you and it can affect your credit. And so I just want to make sure that what was said is true before I give a comment or any of us give a comment.
No pude escuchar la traducción, perdón, al español.
So from my experience, they actually can call because it is a debt that was sold from the hospital to the collections agency. So unfortunately, there is a space that now, because they're calling, and if the calls are being ignored, it's now on the credit score, which can affect multiple things. And so unfortunately, this is a personal thing. So I don't want Carla to feel as if she needs to go into details about all of that. However, if any debt is sold from a hospital or if it's Quest or anything, if anything is sold to a collections agency, the agency can call you to retain the amount of debt that is owed. And then it's the responsibility of the patient or the receiver to pay that or set up a payment plan or something with now, unfortunately, the collections agency and not the hospital. And so what we're looking to do, and many individuals are part of this coalition, excuse me, especially with the bill that's in legislation right now, is that before it gets to collections. So unfortunately, what has already happened is that the debt collectors are calling, but before it gets to collections is that the hospital is either calling or setting up some type of universal application, so that if you do qualify, you are able to work the terms out with the hospital prior to it going to collections. And then also, as there is proposal currently in legislation that, and hopefully fingers crossed and all of the things, that there is supposed to be a buyout for medical debt. What that looks like in the details is still to come on who qualifies, how much of that debt. So I don't want you to necessarily, again, this is unsolicited advice, even though you're saying it's a don't say Aisha told you, but they're going to continue to call until that debt is bought out. And again, if this legislation passes this year with the governor's proposal, it potentially could wipe out the debt that they're calling you about.
Awesome. Thank you so much, Aisha. I do realize I'm looking at time and I want to be mindful, but I do want to allow Lori and Minerva to get their questions and or comments in.
Hi, my name is Lori Savage. I work under the supervision of Robin Anderson from the Ministerial Health Fellowship. I am a case manager. I cover the Fairfield County area. And I have a question. I just have an incident where I was with a participant who not only have a barrier with her medical issues, she has a barrier with language barrier, literacy of understanding how to read or write, didn't get the proper treatment, wasn't assessed with a proper social worker as far as her medication, didn't realize that her Medicaid and her Medicare and her Husky wasn't active, so she had to pay a copay. Didn't understand the fact that she had to pay the copay because she couldn't understand the prescription. It wasn't given to her properly, and every time she was asked that she understood, she said yes, only because she was probably afraid or just not understand the whole process of her having to have to pay a copay, not realizing that her Husky had relapsed and it didn't kick in with her disability. So it's very important that we try to, seek out the bills that we need to seek out to get help for the people that already are dealing with barriers that they have. I had to go in and aid with her emotional support, with her doctors, with her family members. And now it delayed her surgery, but she did get able to have her surgery. Her Husky is now reinstated alongside with her Anthem and her disability. So she's doing well as we speak, but she had to go through that. And now she's in recovery because of it, because it was a postpartum surgery that she should have had months ago.
Wow. Thank you, Lori, for sharing that story. It's important that we understand what's happening in our community. Thank you. Minerva, before you respond, I do just want to remind our community members that our panelists are unable to answer very specific personalized questions. So when we do ask questions of the panelists, if there are questions, their responses are going to be much more generalized and speaking from a bigger place, just as a reminder. So I'll have you go, Minerva, and then we'll wrap up this evening's event.
Yo no tengo pregunta, no question. I see the duda for I sí tengo dudas. Es muy importante lo que ustedes hacen y para eso cuenten con mi apoyo, porque hay mucha gente que hasta ha fallecido en su casa esperando una cita médica que no tienen seguro. Ahí tengo el ejemplo de mi esposo. Mi esposo se cayó en el trabajo y tuvo casi al perder la mano porque la tenía de todo color, la tenía bicolor, amarilla, morada, de todos los colores. Se le estaba poniendo todo negro porque tenía la mano rota. Incluso los médicos estaban asustados porque pensaban que iba a perder la mano. Un mes con la mano rota. O sea, la sangre por dentro, el derrame de todo. Entonces, para nosotros los indocumentados es muy importante por una sencilla razón de que unidos somos más y unidos podemos ganar muchas cosas. Lo que no puede lograr el gobierno lo podemos lograr nosotros, pero juntos. Entonces, yo animo a todas las personas, las que estamos reunidas hoy aquí, que luchemos por el bienestar, porque somos personas, no somos animales, y yo creo que tenemos derecho. Gracias, muchísimas gracias por tan valiosa información.
Minerva, thank you so very much for bringing your story to the forefront, for your thanks and for all of your support. We really appreciate you, and we appreciate everyone else who has come to participate in the event that is also supporting the work that each of our agencies are doing. We really appreciate you guys so very much. So with that being said, we have kind of run out of time. I just want to remind everyone who is present that there is a link in the chat to our post-event survey. We would really, really appreciate if you would actually respond to the survey. We would really like your thoughts about how we did, how this event was for you, and the things that we can improve upon. Your feedback for us is extremely important and will help us to continue to create wonderful events that you all need. So on behalf of the Health Equity for the People by the People Coalition, I want to thank everyone, all of our panelists, each and every one of you, all of our guests that have come in to take their time out of your busy schedules to come and share your expertise, your participation, and your thoughts in this space tonight. And we appreciate each and every one of you. And we hope you all have a very good evening. Good night, everyone.
Night.
Thank you.
Good
Good night,
night.
everyone. Thank you very much.
Good night.
Good night.
Good night.